All right. Hello, Dr. Mike, and welcome to the Health Detective Podcast. How are you?
Great to be here.
Yeah, it was cool. When Dr. Mike hopped on, I'm like, oh, damn, I know this guy. We had been at Biohacking Congress together in Miami. That's the place to be. It's a little small of a conference, but it is fun. There's nothing like talking to some fellow biohackers in Miami. It's always a good place. So we got an interesting one today. And for those that, maybe are listening for the first time or listen not so regularly, the regular listeners will know this. I always like to go into any episode when I'm learning something new or hearing about something new with the perfect amount of ignorance, right? Just enough that I'm asking good questions, but not so ignorant that I don't know anything. So this was very interesting to me. I understand that these things can do a lot. I'm particularly interested in the mental health side, but that's my own bias. There's a ton of things that we can do here. And also, just a quick reminder in case you skipped my intro, which I hope you didn't, but you guys can watch this on YouTube as we do have some slides. But Dr. Mike said we will also talk in such a way that you could still get plenty from this just listening to the audio. So not required, but go to the link in the show notes for the YouTube. It'll be right on top, even before the description. So, Dr. Mike, I think one of the first things that I wanted to ask, just to define something before we go further today, is what is a medical food? Because I understand that that's a pretty big thing of what we're doing here. It says encapsulated medical foods right there. So how do we define that?
Yes, that's a great first question because, frankly, between you and I hate the category name, medical food.
Okay.
When I first heard of it, I thought it was whatever, a bar, a green drink, or a powder, right? And, I think a lot of people think of food. I mean, food is medicine, but this is a specific FDA category. And I think the best way for me to explain it is in comparison to drugs, which everyone knows get FDA approval, and drugs are either prescription or over the counter, right? But they're new chemical entities that go through a very long, typically multi-year, 5-year or so approval process, and then require prescription, then ultimately become over the counter and generic, right?
Right.
And as you know, drugs are associated with a variety of side effects, and they're chemicals, right? So, and then on the other hand, everyone's familiar with supplements, which in the last 30 years and continuing, we see a large growing utilization of, and large populations that steer away from pharmaceuticals in hopes that they can manage disease with supplements, which are typically more natural elements. So medical foods are not drugs and they're not supplements. They fall in an FDA category between the two of them. And what they are is specialized formulations that are addressing a nutrient deficiency in a particular disease state that cannot be met through a normal diet. So that's the biggest criteria from a definition, is that it's a specific formulation designed to address a nutrient deficiency, to treat something nutritionally, for a particular disease state, that you cannot meet through a normal diet. And then the other aspects of the definition are the ingredients have to all be GRAS, G-R-A-S, which stands for generally recognized as safe. So that means you're dealing with essentially vitamins, minerals, amino acids, and certain botanicals, natural elements. Okay, so GRAS category, the manufacturing, which is FDA regulated, has to meet a certain standard called CGMP, which is certified, GMP manufacturing, right? And that's a high level of manufacturing. The reason that's important to note is because the world of supplements is not held to GMP manufacturing. GMP is pharmaceutical grade. And what's been found over the years is that many supplements don't actually have in them what is referred to on the label. So if you're not a certain level of quality of your manufacturing, which is pharmaceutical grade or CGMP, you can't really know what you're getting in the bottle. Now, certainly there's many good supplement companies who adhere to very high manufacturing standards, and some do use CGMP manufacturing standards, but there are many. I mean, you could make something in your garage and mix a few powders and call it a supplement and market it have all sorts of contaminants or inactive ingredients and not even put in what you're saying is in the bottle, and people don't really know because supplements aren't regulated in that way. So the next criteria, so we have CGMP manufacturing, GRAS ingredients, specially formulated to meet a nutrient demand of a disease state, and these require physician supervision. And that's an interesting one because essentially we put it on the label and we have people have their doctor let them know that they can manage the medical food, because we don't want people just stopping prescription medications without consulting a physician if they're being treated. In other words, if you have a neuropathy, a peripheral nerve disorder, and you're treating with gabapentin, you don't want to just start our medication, Procura, which is not a medication, it's a nutritional medical food, and just stop your medicine. You want your doctor to control that and slowly wean you off. So again, when I first started prescribing these, they were prescription only, and that's very interesting. These were prescription only products when I was practicing and had a number of clinics that I tried them in. And I said, wow, so I have all these natural products that have big science behind them and clinical studies against big pharmaceuticals, and they're all natural and they're safe, and there's studies on their effectiveness, and yet they don't have any side effects and they don't have any drug interactions. So they were prescription only, and they were being paid for by insurance, on average about $400 a bottle, which was pretty impressive. I did very well utilizing these in my multiple clinics that I had, and then I went on the podium as a UCLA professor educating doctors, and we had thousands of patients around the country doing well, treating problems like sleep, chronic pain and inflammation, neuropathy, obesity, fatigue, with these natural encapsulated medical foods. They were getting reimbursed by insurance. These people were getting often off their prescription medications or reducing them considerably. And I thought this was the greatest thing since sliced bread. And then the story goes that ultimately the FDA came in and said these can no longer be prescription only, and the medical reimbursement through insurance at $400 a bottle slowly began to disappear. And the old company, well, this company, which is 15 plus years old and has a big science team, kept fighting the battle to get Medicare to approve it and insurance to reimburse it. And they ultimately went into debt. And I came and bought the company, dropped the prices tremendously, and went out to get these directly accessible to the public with physician supervision, but dropped the price to about $60 per bottle retail from $400. Wow. And also started selling into the practitioner markets. And I know you have many functional medicine practitioners in your network. So when me and Reed met, I was like, this is great, because we sell a lot to chiropractors, we sell to IV clinics, we sell to primary care and integrative physicians, many who do functional medicine. So that got me very excited to bring this to your world, because we have natural solutions with big science, no side effects, no drug interactions, that could treat a multitude of very, very common conditions safely. So I'm excited to bring it to your practitioners and give them a great revenue model as well, because we drop ship and we could set them up with online web stores. Sorry.
Wow. All right. Well, thank you for that introduction. It's funny because you were answering questions that I was coming up with in my head as it happened, because I'm like, well, what the heck happened, right? How did these things not take off a little more? And I appreciate you bringing to light the aspect of how supplements, so not these, but supplements are regulated, or the lack thereof with the regulation. Because sometimes I think even our practitioners don't get this, but it's mostly the clients that they work with. They'll be like, well, why do I have to spend this amount of money that's extra on something from, I don't know, a company like Thorne versus the grocery store? Like, isn't it the same? And I'm like, oh my gosh, not only is it not the same, sometimes it can be downright dangerous.
Yeah.
Dr. Mike, we had a client recently that we weren't telling them to go buy it yet. We were just talking to them about something that's offered by Biobotanicals. It was GI Detox. And this guy he goes and buys it on Amazon. Now, we don't know where he got it from, but he keeps coming in. We have an in-person business here, and he kept coming in saying, "Oh my gosh, like I feel like this is making my skin worse," and because he has some acne. And I'm thinking, GI detox. If he's drinking water, if anything, that should help acne. That shouldn't hurt it. And he swore that this was happening. And my girlfriend, she's an FDN practitioner as well, finally got like super, super smart with this and put on her detective hat. And she had him show her the bottle. So the bottle looked identical, Dr. Mike, but when you pulled out the capsules from actual GI detox from Biobotanicals versus the one he got from Amazon, completely different color.
Yeah.
We have no idea what the hell this guy was even taking.
Right.
So we told him to get off of it, of course. But what Dr. Mike's saying, guys, is very real. Like, this stuff's not regulated, and that company's going to have no consequences for what they did to our client. It's scary.
Yeah. That's a really important point to emphasize, because even though there are some very good supplement companies, many of them are practitioner only, many people go buy supplements over the counter, CVS, and many of the supplements really don't have what they portray and have a lot of they have paraffins in them, phthalates, parabens, phthalates, just a lot of toxins. They have dyes in them, just like a lot of pharmaceuticals do. And many of them, you don't get what they say you get in the bottle. So I do take some supplements that I think are physician brands, but the medical foods have a very, very rigorous science threshold by the FDA. And we have, what's the most unique thing about them is we have clinical trials, double-blind published studies against some of the most common pharmaceuticals out there. So as you know, for pain and inflammation, probably the most common thing used worldwide besides aspirin is ibuprofen. Ibuprofen and naproxen, which would be like Advil or Motrin and Aleve. And we have published double-blind studies, comparing Theramine, our lead product for chronic pain and inflammation, comparing it to ibuprofen and naproxen, showing, great efficacy, much higher safety, and an ability to reduce inflammation based on biomarkers, CRP.
Wow. Okay. See, this is I'm very interested in this part because unfortunately for myself, I've been someone that I've always been good with the health side, but Advil was definitely something that worked super effective for me. And so I got my wisdom teeth out. It was a terrible, weird infection thing, impacted, long story. And I had to take ibuprofen for quite a bit just so I could freaking talk because it's my job, right? Is to be speaking to people. And I ended up getting an ulcer from that round of Advil because I was taking so much ibuprofen all the time. And it's amazing that people, they just don't even read the damn back of the bottle. My sister, God bless her, I love her to death, but I'm calling her out right now because she's a nurse, for goodness sake. I watched her on her college graduation day from nursing school, mind you, throw back 2 Advil before she was going to the party to drink all night. I'm like, what did you go to school for? Are you crazy? It's one thing to do it the morning after, but my God, 2 of them before you're drinking. And for those that don't know or never read the bottle, that actually increases the risk that you're going to have a very severe side effects from that. So something like Theramine, I'm interested in this. I know we might not have time to break down every single one, but just to give an example here, all right, we have the studies on it. We know that it has a high level of efficacy and certainly, how could it be worse than ibuprofen, right? So it's definitely safer. What are the ingredients in something like Theramine, just to give
Cassandra, if you want to pull that up, but I'll give you, I think while she's pulling that up, I want to go through something that I think is very important for you to understand about, the whole concept of our medical foods. And Cassandra, I'm looking for the one on Theramine in particular with all the specific ingredients, but not this one. But you could leave this for a second as you're looking for it. So the concept of how our medical foods are working. So this is a patented messenger amino acid technology. And what we're doing is providing amino acids, which are the building blocks, of neurotransmitters. So we provide amino acids precursors, as you can see in this slide, the precursor, which in the example we're looking at, you could see 5-HTP, which is 5-hydroxytryptophan. That makes serotonin, right? So serotonin is one of the neurotransmitters. And neurotransmitters are the signaling molecules, from nerve to nerve throughout the body, right? So neurotransmitters regulate all our systems in the body where we have nerve junctions, right? And it turns out that, you require at a cellular level a certain level of neurotransmitters to maintain the body in homeostasis, in perfect balance, so the function is optimized, right? And what we've learned is in all the chronic diseases that we treat, when you have a disease state, let's just take chronic pain and inflammation, there's an increased metabolic demand at a cellular level. Okay, so the cell actually requires much more neurotransmitters in these chronic disease states, and it's been proven, and we have lots of white papers and lots of literature on our website of medicalfoods.com. It's proven that there's a relative deficiency of the neurotransmitter because of the increased metabolic demand associated with the disease state. So if you think of it, it's like, a car running efficiently at 55 miles an hour. If it starts going up a massive hill, it consumes more gas, right? Because it's not as efficient. Or an electric car, your electric draws much more. So that's based on the increased metabolic demand of the cell in the disease, because it has to work harder to regulate its energy. And it does that and requires more neurotransmitters, and the neurotransmitters become deficient. The more chronic the disease commonly, and the more to the degree, might correlate with the deficiency in the neurotransmitters. And what we're doing is we're producing neurotransmitters with this amino acid technology by providing the precursors and a number of botanicals in a certain, step. This demonstrates the step. We give example 5-HTP. We combine it with some micro doses of cinnamon and theobromine. The cinnamon causes it to get uptaken into the nerve cell. And then, we have something that inhibits the slowing down of it called the adenosine brake. And then we activate the neuron and decrease things that inhibit it. So you don't get a tolerance with these like you do with many drugs. So that may have been too much of a mouthful, but the examples with Theramine, and Cassandra, you could pull up the slide, is we have things in it that include 5-HTP, which is a precursor to serotonin. We have GABA, which is an inhibitory, neurotransmitter and amino acid. We have acetylcholine, which we have choline, which is a precursor to acetylcholine through this technology. Acetylcholine also is an inhibitory neurotransmitters. Many of these work to dampen the signals through the spinal cord that are happening in chronic pain. So if you could enlarge that, please. I think she could enlarge it. So you'll see GABA, choline, arginine is another amino acid which produces nitric oxide, which has a vasodilatory effect, also an anti-inflammatory effect. We have histidine, L-histidine, which produces histamine. So in all of our medical foods, we have a variety of amino acids, and these certain botanicals, like I showed you before, will have theobromine, sometimes have cinnamon, a variety of different botanicals that play a role through our technology to basically regulate the neurotransmitter levels and balance them so that the cell is optimized and can promote natural healing. So what we know in functional medicine, why I was so excited to talk to Reed about this, the whole basis is let's treat the underlying cause and let's see what we can manage nutritionally. We all know food is medicine. So if we could have the cells optimized with their neurotransmitters, right, they're going to be in balance and promote natural healing instead of just what many of our pharmaceutical drugs do, which is just treat symptoms downstream.
Sure. And yeah, what I'm looking at this on is, some are on audio, but what Dr. Mike said is accurate. I mean, this is nothing crazy. I mean, half of our practitioners probably take some version of this stuff in a different way, but really it seems here that, you actually have the studies on the dosages, it seems, and how to mix them together so that you're getting a synergistic effect. Because, like, for example, when we're talking amino acids, a lot of FDNs I know are on some type of EAA supplement. For those that don't know, essential amino acids, and they genuinely feel good on that. But of course, that's the same dose for everything. It's not meant to actually address any specific condition. So I'm honestly finding this fascinating because I didn't even know these things existed prior to getting the information for this podcast. So this is really cool. And I think that, I don't want to go too off track, but I have this question here because I believe I mean this more in the big system picture. What are they doing something to suppress this? Like, why do I not know about this after 6 years in the space? Because this seems like an obvious thing to use.
And that's a big question. I'll spend a few minutes on it, but let me first finish on what you brought up, which is very important.
Sure.
Cassandra, you can bring that slide back up. But so the ingredients, yes, we have clinical published data on all of our specific formulations, which are combinations in milligram doses of these different ingredients with a variety of the botanicals in very specific doses. And that works with our amino acid technologies very specifically, which is patented. Because people just go say, well, why don't I just go buy some GABA and L-arginine and histidine and 5-HTP and choline? I'll just take those things, and it just doesn't work like that. It's the specific combinations with them, certainly of things like grapeseed extract, theobromine, cinnamon, specifically designed to work with the patented technology in combination with these specific doses of all our neurotransmitters, which differ in every single product and often have clinical trials, human clinical trials, double-blind, the gold standard, comparing them to pharmaceuticals, showing perfect safety and strong efficacy. So coming back to your big question, which was my big question, why doesn't the whole world know about these? And why isn't everyone taking them? So what happened was the company, which is 15 years old and had like some very prestigious doctors, all UCLA professors, and like our chief medical officer moved from the older company to, since I bought it, the new company. He was the chief medical officer of Herbalife, Harvard-trained guy. We had the prior medical director was the chief of rheumatology at Cedars-Sinai, another UCLA professor. The scientists behind, they were all part of the initial clinical trials. The scientist behind it was a well-known cardiologist who had a big lab history. And I think the problem was they knew this worked and they had good human data, and they didn't take into account that when you do something like this, you're sort of going up against big pharma, right? Because we have natural solutions here to so many different problems. We're talking sleep, fatigue, cognitive decline, chronic pain and inflammation. We have things that help with anxiety and depression. This is working on how the brain plays a role in pain and plays a role in many, many diseases. And really, once the FDA came in and said no longer prescription only, and the insurance market dried up, the company just wanted to keep fighting the battle because, as you said, they know things like ibuprofen, which many people live on, can be very, very toxic. I mean, when you look at the morbidity and mortality statistics in population health of things like, ibuprofen and naproxen, look at the incidence of gastrointestinal bleeds and gastritis and cardiac side effects and renal side effects. This is true for many, many medications. So ultimately, these do become a threat when you have natural elements. And ultimately, once the FDA said no longer prescription only, insurance companies just decided not to pay. And the real reason they didn't get out, and why I came in and bought this company, is because the old founder and team just kept fighting the battle to get Medicare approval, which rightfully so, they should have gotten that, and they should be covered by all insurance companies because they safely help people and should be first line in every disease with all these symptoms. However, that's a different battle that could take many years and many, many millions, and it basically ultimately nearly bankrupted the other company. I came in and said, let me just drop the price to $60, sell them through practitioners, offer them online through my pharmacy to consumers at $60, and sell them to practitioners for much cheaper. I could sell them for $25, you could sell them for $50, and still give your patients a big break and get them off pharmaceuticals and have safe long-term options. I mean, you can manage arthritis. We have people on these for 8-10 years. safely losing weight, treating chronic pain, treating neuropathy, often getting their medications completely, taking them off completely or getting them down 50%, 75%. One of our big studies combined naproxen with theramine and showed you can reduce the dose of naproxen, which is Aleve or naproxen, by 70% and get the same effect. When you reduce the dose by 70%, combining it, you eliminate like 95% of the side effects because, most of the side effects of a majority of medicines, other than allergic side effects, which are rare, most side effects are dose related. So if you could combine things with a medical food and get your dose down, like you take a sleep med down by 50, 75%, combine it with one of our natural sleep meds, you're going to eliminate many of your side effects like daytime fatigue, confusion, cognitive decline, nighttime falls. So we have two great products for sleep, Centra PM and Gabadone. And we have, the Centra PM was studied against trazodone, which is one of the most widely prescribed sleep meds on earth. And again, no side effects, great efficacy, managing the sleep disorder nutritionally. Same for Gabadone, works more with sleep disorders with anxiety. And we have many people on 2 or 3 of these. Like fibromyalgia patients I have on theramine for the pain and inflammation, Centra PM to normalize their sleep, and then Centra AM for daytime fatigue. No problem with 3 meds, and often off their other medications.
That's amazing. And honestly, the one thing I know that you said the price in the beginning, but then you said it again for $60 a bottle. I mean, I'm thinking about this, and quite frankly, because people like FDNs and many other functional medicine practitioners, they're using such high-grade supplements already that, like, those prices are either comparable or they actually beat a lot of the supplements that aren't even technically regulated in the way that these are. So that's kind of and they certainly don't do things as specifically as these do. I have a very personal question, if it's okay. So one of the things that's on here, if you're just listening on audio, there's a lot of different things that they can help with, but I see sleep disorders and anxiety. And I'm wondering about acute anxiety because, Dr. Mike, I've been able to pretty much nail everything. I used to have panic disorder, depression, generalized anxiety, don't have any of that.
Right.
However, the one thing that gets me is I travel all the time, and it's not every time, so it's good. Man, listen, I just don't believe we were supposed to be 35,000 feet above the ground. And flying does get me. I do have a prescription for something I don't like taking, but I'm not ashamed of it either. But it is alprazolam. It's Xanax.
Yeah.
And so I would love to have a time where I don't need this at all and still actually feel okay when I get to the destination, because I cannot take it, but I feel like I just lost a year off my life. I don't get into a panic attack, but it's not fun. So would something like these, would this work for an acute thing like that, or would it be more generalized anxiety?
Well, I mean, they are more generally for chronic because, again, it takes a little while often for the neurotransmitter levels to increase depending on how deficient they are. But I would say that we do have people respond to things like Gabadone and Centra PM immediately. And if you could sleep on a flight and get away with Gabadone instead of Xanax, makes perfect sense to try it. There's no downside. And, you might be able to take half your Xanax dose with the Gabadone and sleep well, but again, no downside. At all.
I like that you actually said that because, admittedly, I won't tell anyone what the dose is, but let's just say it's a dose I'm not particularly proud of.
Right.
So it's more than 0.5 milligrams, I'll put it that way. So The reason I thought about it is because you talked about if it could be reduced.
Right.
That's really actually what came to my head is I can't picture this anxiety thing with the planes is obviously more to me than just a health thing because the rest of my life I'm not anxious at all.
Right.
It's a very circumstantial thing, but anything that can half it sounds good to me, or even less. But I know I can nail it one day. I'm doing a lot of things for it. It's just something I'm working on.
Mm-hmm.
So, all right. Anyway,
I'm sure things like breath work, meditations, etc. are always the first lines, right? But this is a purely nutritional addition, and I tell practitioners like functional meds. We sell to a lot of chiropractors, integrative docs, pain docs. I taught in the med school as a professor at UCLA for 30 years. And when I have something that's perfectly safe with no downside risk, I say to people, like, your functional practitioners all have people probably buying over-the-counter Advils, and they have a medicine cabinet with supplements and melatonin. These have big science behind them. They're FDA regulated with big clinical studies. And it's not, most supplements work, and again, I'm not here to beat supplements because I take a handful, but most work on theoretical sciences. They don't have human double-blind studies, and ours do, and that's really what's unique, you know? And
Yeah.
they're regulating the body to heal naturally by balancing neurotransmitters. And I think that fits philosophically with what every functional medicine practitioner is looking for, which is root cause and getting the body to optimize its natural healing potential.
Right. I would normally save this for the end, but I mean, I'm interested, and I know many others are, so I might have some other questions outside of this, I'm sure. But what is then, you kind of alluded to it already, but what would be the specific model for our practitioners? Because I mean, the price is no different, honestly, than any of the high grade supplements that we use, but you got so much more behind it in terms of the science, efficacy, like you said. I mean, it's a no-brainer to me, so I'm already interested. So what would that look like for our
Sure,
practitioners?
and you know, I can tell you what the standards are because we're moving a lot now in the chiropractic space and the IV space, and a number of those are functional docs. So we sell them, you know, again. So the person will go online and see it retailing for 60. Most of the practitioners are selling them between either 40 or 50 per month, which is pretty cheap. So it's a big discount, right? So, and you're buying them, if you buy bulk, it's $20, which most do. If you're buying small amounts, it's $25. The reason bulk makes sense is at $20, we also set you up with a customized web store. We'll drop ship
nice.
anywhere in the country to your patients. And your patients, even though they might not be coming in regularly to see you, you know, they may come in every few months, they're likely ordering these things forever on subscription if they're working. We have people losing weight off these for 8 years as their main weight loss thing. So it's an appetite suppressant. We have people who substitute coffee for Centra AM for fatigue in the morning and alertness, and they just take it every day. So, you know, you'd be able to buy these in bulk for $20, have a customized web store where we drop ship. We'll give you e-blast to send out. And you're making, you know, and you're listing them for whatever you want, 40, 50, 60, but 40, you're doubling your money, 50, you're more than doubling your money, and your patients at those numbers are still getting a great discount. And we also have a program where we will, you know, we'll let patients try a first bottle free. You know, if they're not, I mean, that doesn't really work for Medicare because you're not supposed to, I mean, we could do it, but you're not supposed to give something that costs more than $15 free to a Medicare patient. But we don't bill any Medicare here. I don't know, you know, if for a cash practice, it's fine to, you know, if your patients really wanted to start it, they could go to our website. We could give you a code. They could get their first bottle for shipping and handling only. And then if they like it, they could be part of your web store and get all their refills there. So it's really an incredible sort of no-brainer, safe, passive business model with really helping people with nutritional medicine.
Well, and I think that just, I mean, I guess I was about to say, I think that shows the belief in the product, but it goes beyond belief because I have the website up. I mean, yeah, you guys do have, I haven't read through the entire studies, but he's not joking. Like, there's some really great stuff out there. So I think it's just smart because you know it's going to work. That's amazing. One thing then I'm really curious about, speaking of the studies, is I'm assuming that the people that are doing the studies are not necessarily individuals like you and I or the FDN practitioners that are, you know, being super dedicated to this holistic lifestyle. So, Dr. Mike, I have the business that I have in person. It's kind of a mad science experiment because I call it a light therapy studio. It's red light therapy, specific tanning beds, vitamin D lamps. It's wacky, and I love it. Infrared sauna, of course. But it's been a gift and a curse because we have patients that are coming in and really getting a lot of help, and that's a blessing. However, because it's relatively low cost, I also get people that come in and think that's all they're going to do. They're not interested in working with labs with me, but I still want to support these people. So if these people have conditions that I know of and they're unwilling to change a damn thing, I mean, these products, the medical foods, those studies are done on people that are just still living normal lives, right? And they're actually still working that well?
Yes. And these were done by very academic professors, who practiced very traditional medicine initially and just integrated these into their practice. And again, they were prescription only. And they were being reimbursed $400 by insurance companies. So now we get to bring them directly to all sorts of practitioners. And, you don't have to worry what meds the person is on. You can add these on without any complications. And then, I tell practitioners after a month or so, they could try and drop the prescription meds if they're the prescribing doc by like 25% after a month. And every few weeks go down another 25% and see where the patient ends up.
This is amazing, because for us, I mean, again, I have an understanding of how, again, it's a little scary, the supplement space, when people actually know the lack of regulations and the things that can happen. So, and either way, as FDNs, generally speaking, we're not people to just throw supplements at something when people aren't willing to do the work. But this is different. I mean, it is legitimately different. So yeah. I'm already really excited to, I'll share this with my girlfriend afterwards, because she's the one that works in the business a lot with the people that are coming in. And Dr. Mike, there are so many people that come in that have these specific conditions. They're in the treatment mindset, right? They don't want to change. Right. And I'm not recommending it, but I still want to, I'm a human. I want to help these people. I don't want them to suffer. Mm-hmm. And so the fact that I can now say, okay, cool. Hey, dude, you got diabetes, because we have people like that. You can try this, just pay shipping and handling. There's no side effects. Don't have to worry about the medication side. Obviously, talk to your doctor, but like, you're good to go. And if you liked it and it worked for you, then we can talk about ordering more. And it's still cheaper than most of the supplements I would recommend. I mean, that's, yes. I don't, and there's no am I missing a catch, or is it just this cool?
Yeah, I mean, there's no reason someone wouldn't try it, whether it's to lose weight, get better sleep, chronic pain and inflammation, fatigue, cognitive decline. There's really no reason, because the safety is perfect on it. There's no drug interactions. And if it helps, you have a natural, safe, nutritional solution that's promoting natural healing. Why wouldn't every practitioner recommend this? You don't even need any lab tests for this. And I'm not discouraging people from going down rabbit holes. I'm all for functional medicine myself, 100%. But as you say, some people don't want the lab test. They don't want to get too deep. This is a somewhat simple way to intervene with almost all your patients who have a symptom that's on our list. And it's a great way to get them started. And we give you office kiosks with little you could have a lot of practitioners keep a small inventory in their office, so they give them the first bottle. Then the patients come online for their follow-ups. Again, web stores are customized. You're giving patients big discounts. If you don't like to keep anything in your office, we could do it all by web store. Some doctors combine it. So whatever works for you.
Cool. And yeah, that's the thing, right? My God, the people that work with a lot of clients listening today, they already know this. We would want everyone to live our lifestyle. We know it's not realistic, and we have empathy, because most of us have been through our own health crap. That's why we got into FDN and things like that. So listen, it's not an excuse to not go do anything else, but we all have those family members or friends that you've been doing this for 5-6 years and they still haven't budged. No, this can be a great thing to add in for them. And that's it's kind of my major last question, and it might provoke a few stories, which is totally cool. We still technically have 10 minutes. We don't have to use it, but I'm very curious about, we have this objective data. There's all these studies, and I'll link them in the show notes so people can read them. So that's the objective side. But for someone like you who's been working at this so long, I'm curious about the subjective side. Like, what are some really cool stories? Especially, I'm really interested in the mental health side and the pain side. Sure. What are some cool stories of people that you've heard getting great results with these things, particularly for the mental health or pain?
Yeah. So, well, just aside from mental health, I want to mention one thing about obesity, because obviously sure. half the world's taking this semaglutide now, right? We know what's going on.
Oh, yeah.
Prescription meds. And look, I hope they end up safe in the long run. But, my chief medical officer, who's, well-known Harvard-trained doc, wrote famous textbooks, and was the chief medical officer at Herbalife. He's been prescribing these now. He has a very high-end concierge practice in Los Angeles. He's been prescribing them for 15 years daily with many, many patients. And his partner, who is a rheumatologist, lost 120 pounds and stays on Aptrim as his appetite suppressant for the last 8 years. So, because this decreases craving. And as you know, much eating is from cravings, and a lot of these are balancing the autonomic nervous system. It's important for you to understand how a lot of neurotransmitters work. So most people are dysregulated from an autonomic standpoint. That's the sympathetic and parasympathetic, fight, flight response versus relaxation. And most of us, because of technology and the fast lives we live, have a degree of autonomic dysregulation. Many of these work through helping regulate the autonomic nervous system. And so like our appetite suppressant works by decreasing cravings and normalizing mood, So, because when you talk about mental health, like we talk about things like anxiety and depression, now we are learning more and more how much the gut plays a role, right? Because
Sure.
it's the second brain, right? And what we eat affects our moods, and there's an enormous amount of neurotransmitters in the gut, right? So here we're addressing neurotransmitter levels, and I've had quite a number of people get off long-term sleep meds that also serve their anxiety, and just with either Gabadone or Centra PM managed to get restful sleep. I had a number of people taking Centra AM for fatigue who realized they were usually wired from coffee and more anxious, and now have something that just makes them more alert and is natural, balancing their cells. So I think for mental health is such an issue right now, and there's so many different supplement pathways. Again, we have a long-term safety and science on these, and we're working with neurotransmitters. So I encourage someone who's anxious and has difficulty sleeping, try something like Gabadone. You have nothing to lose. We're glad to send free bottles. And let's see people have an option. And Centra PM also has been shown to work in depression as well.
Cool. I got another selfish question real quick, but I know we have practitioners that work with many clients like this. I'm curious because on the screen that I can see, it might be the one for inflammation, but is there one here in particular that we work with a lot of people with severe acne at the red light therapy studio? And unfortunately, these are the same. They're usually younger and they're unwilling to kind of do the lifestyle stuff. So they're looking in the treatments. Is there one of these that might be supportive of people like that?
I would say if they're not getting off their sugars, which is common, right, and changing their diets, Theramine, which is our number one product, and we have over 30 million doses safely prescribed without significant adverse side effect over 10 years. Theramine is for chronic pain and inflammation, and in our studies it does show to decrease inflammatory markers. As you know, inflammation plays a role in many, many things, but we don't have one directed at acne, so to speak, but I would just say if there's some chronic pain associated with it and inflammation, that Theramine's been our lead product for many years. And as you know, people with pain, there's not many options. They take Tylenols, can be tough on the liver, Ibuprofens on the kidney, bleeding, gastrointestinal tract, and we have, perfectly safe natural options for this with amino acids, with Theramine and Tretinoin for osteoarthritis and chronic pain and inflammation.
Yeah, no, Dr. Mike, you're doing a wonderful thing, because the second biggest type of person that comes to the studio is pain management, right? Red light obviously attracts a lot of people that are doing that. We don't even advertise that, and they just end up finding us. And so to be able to say, hey, you know what? You got nothing to lose here. Check this out. Pay the shipping and handling. These people have spent tens of thousands of dollars.
Right.
Shipping and handling is the least of their worries. Yep. For no side effects.
Uh-huh.
You're right, because there's no good answer to pain. You're absolutely right. You got your opiates, you got acetaminophen, you got ibuprofen. These are not, these are really serious drugs. Yeah. People think because you can go to a CVS and buy this stuff. I know the FDNs know better than this, but your clients, guys, think that they can just go to the CVS, and because they can buy a bottle of Advil for $5, it's not a big deal. No, it is a big deal. A lot of people end up in the hospital every single year because of the GI stuff. And I always forget this, because you're right, it's even scarier than that, because I forgot about the cardiac side, and you brought that up. It's like people have heart attacks because of these things. There's major issues. So, but at the same time, we get it. If you're in a 9 out of 10 pain, your life, it's distracting trying to navigate your life every day when you have that. So there needs to be an answer, but it can't be the ibuprofens and the Tylenols at
Right.
super high doses all the time. So this is brilliant. I'm excited. How can we did have some stuff on the screen, but
I
again,
will tell you,
yeah,
I would love to, anytime you want to do an open webinar with Q&A for your FDN practitioners, because I love answering practitioners' questions. I mean, we have a very deep website, medicalfoods.com, like lots of white papers, lots of double-blind published studies. Medicalfoodschiro.com is another informational one, medicalfoodsinfo.com. And I'm Dr. Mike at medicalfoods.com, but I'd love to do any Q&A with any practitioners, because I really think practitioners have to lead this charge for natural solutions to health and using food as medicine in this regard. So I'd really, want to continue to educate and give people a nice passive revenue model, because, as healers, you're businessmen as well. And this really could work. Even when people move out of state, they could continue to be subscribing to a number of these, and you could build up something nice. We had people doing extremely well with this just through passive revenue models, whether in office stores or online or both. So I'm here to help you. We have a great, easy onboarding process, and Cassandra's with us, could get anyone who'd like to set up. Cassandra, can you just show a quick sample in the last 2 minutes of like what a web store looks like for a practitioner? And in the meantime, Evan, ask me anything else.
Yeah, while she's pulling that up, when we are off the recording part, I'll message you, or I'll talk to you real briefly about how we can get you set up. I'd love to get you in our professionals group. So that's a graduate group. There's about 1,000 people in there. They pay to be there, and we love bringing them stuff like this. So that'll be an easy setup. I can get that done for you. But we have other practitioners that aren't actually FDNs that listen to our podcast just for the information and stories. So I know you mentioned a few links and emails or whatever. Where's, like, if I'm not an FDN and I am interested in you now, I know that we have the medicalfoods.com, but if they want to become a practitioner for you that can distribute this stuff, is that the same link?
I mean, they could go through that one and go to, and there'll be an email. It's info@medicalfoods.com. That's correct, right, Cassandra?
Yes.
Yeah, info@medicalfoods.com is the email if they want us to do a demo by Zoom. And they'll find that on the Medical Foods website, like how to get in touch with us. Because, we look to set up practitioners every day and, really help them have this in their armamentarium to safely treat patients' diseases naturally.
Sweet. I'm on it right now. I'm going to get this done. It's cool. All right. And then I know, she's bringing it up right now.
Yeah. Cassandra,
This is an example of provider web store.
Oh, cool.
Yeah, so it's just, purchase and go down a little bit, or the other direction, just the front. I don't know if it's got frequently asked questions, and this is for chiropractors, but a lot of people will put their logo up there. Some doctors put a little video up, like, of themselves touting it to their patients. So we can put a little video up. It'll have your own logo. It's your own custom web store. It's a very turnkey revenue model for people who want to get into this.
Nice. This looks great. All right. Well, Dr. Mike, thank you for this today. Again, let's stay on. We'll talk about how we can do this in the professionals group. But I really appreciate it. I've done a lot of podcasts. I've valued every guest that comes on. But I'm taking what was said at face value today because I don't have any reason not to. And this sounds great. This is one of those things I get excited about. I'm like, this is interesting. So Thank you very much.
Really appreciate it. Thank you.